very good evening to everybody, and welcome to another episode of Eclectica the Different News. I'm very happy to introduce to you all Vivek Mishra, the founder and CEO of Fibroheal. Thank you, Vivek, for accepting my invitation for this podcast conversation, and I'm really happy to have you. And I think we'll have a lot of insights for the wonderful work that you are doing. Thank you so much.
Thank you, Gargi, for having me on your platform. The different news, you are doing amazing work, and I'm glad that I'm part of that, and you have invited me on your platform. Thank you very much, and namaste, everyone.
Yeah. So, Vivek, it's like we are very interested to know what you are doing, but before that, we will definitely like to know that uh, how what is your journey and what is the story behind Fibroheal?
Very, very good point, and it's going to be a nostalgic walk. So before that, I will tell you my background also. I was born in a small village in UP. I grew up in Northeast, a place called Arunachal. Studied in Odisha, did my management from Pune, moved to Bangalore, and that's what makes you versatile and ability to open up your thoughts to various new ideas. So coming to silk and how it happened. So when I was studying pharmacy, we had a subject called pharmacognosy where we read about sutures, ligatures, and we read about various applications of silk as suture. And then you read it, you got the marks, and then decent marks, and then you forget it. Then you moved on with your job, you got your regular paycheck, and start enjoying life in a city like Bangalore. Well, last assignment when I was part of one of Tata Group companies where I was leading the rice seed business. Uh, I was in a place called Dhamtari, which is in Chhattisgarh, about 100 kilometers from Raipur. That's when I saw a tussar silk, that is, which grows on the tree. It's also called hunted silk. And having grown in northeastern part of the country, that is Seven Sisters, Arunachal Pradesh, I had always heard about silk because there is a famous dressing from Assam that is called Mekhla Chadar. So people,
Very nice. Oh
yes.
my God, I love that. I
So
I do own a couple of necklaces as well.
very, very nice, very nice. So Mekhla Chadar, we all, and having grown in that part, that side, two types of silk is grown. That is called Eri and Muga. So now when you see, as you move along, and when you are destined to something, you keep coming towards that. So one was that Tasarwala thing, that was the year 2013. And by the time I had a gentleman named Major General Sushil Jha, who was working with Indian Air Force. He was an Indian Army doctor, deputed to Indian Air Force. He was the one, who also connected me to someone who has built a company in animal health space called Vetcare. And that's how I was introduced to my first co-founder, Bharat Tandon. So it was like a mid-20s guy meeting a early 60s guy. And the strike happened because, I found a mentor advisor in him, someone who has built it, the journey which I want to walk, someone already who have walked that kind of journey. So that's how this association happened. We started work on silk proteins in the year 2014. And we were researched for about 3.5 years before floating the company on 6th April 2017, to be precise. So that's how has been the journey. And also I will mention one line about Fibroheal. Why the name Fibroheal? So silk has two proteins in it. Silk, if you say silk cocoons, there are two proteins in it. One is called sericin, which is the outer protein, and inner protein, which is called fibroin. So we heal wounds using fibroin protein. So it is called Fibroheal.
Wow, amazing thought put in naming as well. Fantastic to know your journey, and it is
Thank you,
wonderful.
guys.
You said rightly that when we are destined. I mean, we keep going in our life, but things what is destined, we will when we start growing at that point, and we will meet the right people at the right time. I guess I believe that very much, as you said.
Very true. Very true.
For wound healing, there are a lot of things that has been there, and still it is there. How this idea of silk protein came to your mind, or I mean, that's something little very interesting to me.
Yeah, that's very interesting. So as I mentioned, once we saw about silk, we dig deep about it. So and what you do, you tend to, nowadays, by the time 2014, 2015, smartphones was there. So till 12 o'clock in the midnight, you get chance to watch your screen, even while sleeping. So sometimes you used to study, watch some videos about silk, and you read about then what we found out is there is a lot of possibilities. Many researchers publish it. This may be, this can be. Now, what happened, since I was not a PhD guy, postdoc, I was not knowing the challenges associated with it. So, frankly speaking, when we started, that point of time, I will show you. This is the type of cocoons what we started seeing. If you see, so I will take 1 minute to also explain. Normally for clothes, what they do is there is a cocoon which is put in boiling water, thread comes out, and
Exactly.
and they make saris or clothes, and the worm is used as a feed for broiler industry or aquaculture and other things. In our case, our starting material you can see is broken cocoon. If you see, so I am as vegetarian as milk or honey. You can say so. I'm not killing the silkworm, you can see. Now what happens is, worm comes out as a moth, butterfly. What is left out is empty shell. What you see. It has two
Right.
proteins in it. So that's where the thought that yes, various possibilities are there. Now when you started reading about it, we realized that the most easy application can be in the area of skin or the outer skin. People are reconstruction, including soft tissue reconstruction, breast reconstruction, hernia. People are talking about different kind of things. But we realized that burns can be one area. So in 2017, when we started, the first thing what we started was burns. Now the question comes, when we got into burns also, the first dressing was suitable for donor side. When you take, for example, if there's a burn case, you take from skin from the thigh region. You take a small from thigh region. So the dressing was used suitable for that because it can improve the wound healing possibility in a much quicker manner. The healing rate is much faster because of the various amino acid sequence it has, and that's what led us to wound healing. Burn. As we moved along, we realized that bed sore, because once you start going to hospital, you see that diabetic ulcer, bed sore. Then you go, yeah, there is a patient in ICU. You go and meet him. Then you realize that there are for old age geriatric patients there is a challenge. People who are hospitalized for 15 days, they develop some kind of wounds. Then as you moved along, we realized that cesarean is a big market, and that's how the journey went. So today we are catering to acute, chronic, traumatic, and post-operative wounds. Application wise, whether it is a normal laparoscopic surgery or a cesarean or burn or diabetic ulcer, bed sore, different kind of cases today we are treating. But this is how have been the journey. One thing has led to other. We started with burns, moved to different department of the hospital, got to know the problems, came back. We have a strong R&D team. We figured out, got the necessary approvals from the Indian FDA, and then moved forward. That has how been the journey. And but there has been no way, there was no eureka moment. It was like you read. It was more of a, what do we say, one thing leading to other.
Amazing. I think the way you took things forward, this is it really, it's fantastic. It's amazing. Thank you for sharing that. As you were telling about the silk proteins, the fibroin protein and stuff. So, what are the unique properties of silk proteins that actually specifically work in case of wound care?
Yes, a very good question, or very good point what you have indicated. So silk protein is a protein which is little heat stable. Generally, protein denatures as soon it is exposed to heat. Silk relatively has little higher tolerance. Point number one. Number two, India is second largest producer of silk in the world. The highest being China. India produces about little more than 35,000 metric ton. And out of those 35,000 metric ton, more than 50% is produced in Karnataka. So the logical reason was to be in Bangalore. So these were the two parts. Thirdly, important part was, of course, I wanted to do something in this area, but we always had a thought that if it is from a source, where we are not, which is little non-violent. Now here, when we dig deep into it, we got to know that there is a concept called broken cocoon, which farmers fear. Now in this case, what happens if a normal cocoon sells for 700 rupees or 600 rupees per kg? For broken cocoon, you have to pay 2,200, 2,400 rupees, because farmer will not wait. Farmer says that instead of 700, if it is 650, also I will sell the cocoon, and because they don't want the crop to lose the crop. So in that case, if I am assuring him, I have to ensure that I will pay you 2x, 3x, so that I compensate all the losses. And the quantity is small, so I will not lift in say 2000 kg or 5000 kg cocoon. I will not lift. I may lift 500 kg, 600, 800 kg. In that case, that's how you have to pay 3x. I mean, on a lighter note, people talk about doubling farmers' income. I'm already tripling and quadrupling it with the silk growing farmers. But that's how you start. Now, one good thing is, the cocoon is much cleaner when you look at this, because many times there are pupa, there are excreta of those worms and other things,
Correct.
but here it will
Correct.
be all very clean. So that's the starting. So these things are now coming to the properties. If you realize, in warm states, particularly southern states, are generally little on the warmer side. People wear silk, and it is much, they don't get any issues. Or you might have seen that people recommend in Korea and other places that you take cocoon and rub it on the face. Those kind of things you would have seen. Or if you have lot of pimples are happening, people recommend you to silk this thing, pillow cover.
Absolutely. Yes. I
Those are
have heard
small.
that.
Yes, so those are small things. Now there is a natural moisture. Silk has natural moisturizing factor, amino acid sequence similar to that of skin, particularly the amino acids glycine, alanine, glycine, serine. So those things are very, very helpful. Apart from that, it provides a scaffold where cell attachment happens. So cell attaches to each other in a quicker manner with that help of that scaffold, and that leads to faster wound closure. So one is thermoresistance, natural moisturizing factor, faster wound healing because of the scaffold property of it, availability, and we should not forget that India is a little price sensitive market. So whatever innovation you have to do, you have to give it at the right price point. So so the good thing is, being a first time entrepreneur was, I have innovation, I have uniqueness, I'm going to replace something from multinational, but it is lesser than the price of multinational. What will heal in 16 days, my product will heal it in 10 days.
Wow.
At a price point lesser than what you are, because since I am making it in India, I'm based in Bangalore, which is about, Karnataka produces 50% of the silk, so I have all those necessary boxes ticked at the right time. So we are able to handle the accessibility and affordability part while being, making the product much effective. So these things makes it a perfect ideal material for wound care range.
Fantastic. So, yeah, you said that like you were not about aware of the challenges. So obviously, I'm sure the journey looks sounds very smooth, but it is not. So I would like to know that what kind of challenges you faced when you really started and you thought to bring it out as a product, and what was your challenges basically?
Yes, so I faced many challenges, out of which one challenge which I have faced and I face still today, I will start with that. That is aligning everyone to a common goal. Asking people to leave aside their ego and work on a common cause. Ki let's make silk protein mainstream. Saying that no, people think that either manufacturing is mahan, R&D is too important. Without finance, nothing will move. Sales guy will say that without me, you guys are nothing. You guys can't earn your living. So, but aligning anyone to a common goal, ki Fibroheal is bigger than any individual, any department. That is a challenge on a lighter part, but it's a genuine challenge, the human level. See, we faced issue with, of course, fund crunch. We faced issue with regulatory because Indian market is still not prepared to fund medtech or biotech startups where gestation period is little longer. They want to fund consumer startups or something which will scale in 12 to 18 months or 24 months time. And while these are genuine problem solving startups where people are not coming forward, and people, secondly, the revenue growth is always slow, because what happens, whatever said and done, it takes time to build that trust. That how an Indian company, the biggest questions what we faced is, यार आपने सोचा जॉनसन एंड जॉनसन ने क्यों नहीं सोचा. Now how do I justify that कि यार मैं जॉनसन जॉनसन ने क्यों नहीं सोचा. But these are some genuine questions, which people asked us, and you have to say that कि सर वो हमारे पास नहीं पता है, madam we don't know why J&J did not think about it. Next part was regulatory approval. Since it's a new material, people were not clear which category it will go into. Medical devices was a new sector which government was focusing on. So all those things were the challenges, and trust me, the first 3 years, 2017 to 2020 was the worst phase, when we were not knowing how to go about it, what to do. As we moved along, we thought things are going to improve. That's when COVID came. So सोने पे सुहागा वाला सीन कि 3 साल प्रॉब्लम के बाद another 2 years when that there was uncertainty also. But trust me, that was the time when the biggest growth of Fibroheal happened in terms of product expansion. Because 3 years we put our head down, we worked honestly in various areas to realize that what are the potential opportunities, whether it is cesarean or diabetic ulcer, bed sore, pressure ulcer, gunshot injuries, and we formed various collaborations. So now in day-to-day time, you may not get that time, but because it was COVID, And being in biotech and medtech space, we were allowed as essential material. So our lab was open, and this is where the product development, the team, and everything moved really quickly. One good thing what we had done is during COVID time, everyone was deducting salaries and money from the employees. We did not deduct single rupee from anyone. In fact, we doled out the highest increment that year. Now that also helped people to come closer and own the responsibility of Fibroheal together. So today whatever is Fibroheal is because of its people and the people who have put forward. These are some of the real life lessons and the challenges what we faced on it. Broadly funding, regulatory, aligning team to a common goal, and then of course making people aware that कि यार तुमको thought क्यों आया, जॉय जेएनजे को क्यों नहीं आया. But these were
So yeah,
these
I think,
were
I mean, very practical things you said, and I mean, the way you have tackled all these things is really praiseworthy. Thank you for sharing all these things on my podcast. I was thinking like we do have conventional wound care products available. It's not that it isn't available. It's not like that. So, can you tell us that how your products versus conventional wound care products?
very, very good and very apt point what you have mentioned, Gargi, both from the seer knowing the technology perspective as well as for the from the people who are going to watch this podcast from their perspective.
Right.
One is currently they use paraffin gauze. Paraffin, to put it in a simple manner, we all know Vaseline, the famous brand. So on a gauze, they apply liquid paraffin, which is Vaseline, and that is the most widely used product. It's called gauze dressing, and that's when you have some products from multinationals who addresses this area, and that is the highest selling, and it sells also at a very competitive price of $50, $60, 50, 60 rupees is what and to top it up, there is an antimicrobial agent which is also added that is called chlorhexidine. Generally, that is used in Savlon or Dettol or those kind of things. So, chlorhexidine plus liquid paraffin is what they use. Now, coming to conventional, what it does, when you apply on the wound, it is just to cover the wound, to ensure that when the cell attachment happens, there is no non-adherence. Matlab, there is not tissue should not get adhered to the dressing. That's why they put Vaseline and then apply the gauze. So it is not actively participating in the healing process. Body is healing on its own, but it is not participating. So dressing wise also there are three types of dressing. One is called traditional wound care, second is called advanced wound care, and third one is called active wound care. Fibroheal is in the range of advanced and active wound care. And one or two dressing of advanced and active is at the price point of traditional wound care. One or two dressing here. So that's when you have to look at I'm innovation. Innovation need not to be expensive. So we are able to demonstrate that. Point number two, when you look at in case of traditional dressing, it's just the wound cover. In case of advanced, it passively acts in healing the process. For example, it will create a moist environment where wound cell attachment happens faster. And third one is, apart from creating moist environment, it will actively participate. So silk protein, there are some proteins which are from animal source, like whether it is collagen, it is silk protein, or it is those kind of materials which falls into purview of active dressing. So they also actively deliver materials, amino acids, and the necessary proteins which are needed for faster wound healing. So once they are acting, once one body is healing, second they are creating an advanced culture, moist environment, so wound is healing faster. Third, they are actively participating. So these are the areas where we are in the second and third area, that is advanced wound care and active wound care, and addressing different things. Now, as you rightly said, most common and most widely used is advanced wound, traditional wound care. Now, to replace something at a 50, 60 rupees price point, you need to have products where we are able to heal those wounds. I mean, I'm happy to share that we are able to give products even at 60 rupees with silver and silk. And this is what innovation does. Once your R&D and other processes are set, once your manufacturing is streamlined, you are able to give products at 60 rupees, even with keeping kind of cutting down your margins. You don't need to, there are some products where you need to keep high margin. There are some products which can be more for the bigger cause. And that's how we have been able to address it. So the idea is to build a company which solves genuine problem, which brings innovation, which has economic multiplier effect. When I say economic multiplier effect, means the farmers, the hospitals, the patients, the infrastructure, and contributing also to circular economy because everything is biodegradable and it's a natural product. So still growing farmers, is his income increasing? Yes, doubling, tripling, quadrupling his income. Cost of treatment is coming down? Yes. Is healing time improved? Yes. So it is good for nursing staff, doctors, and hospitals. Third, it is easy on the pocket, easily available, accessible. And fourth, you are generating employment and also taking care of the nature because it's all biodegradable. So all these things makes it a perfect fit to used as a concept in wound care. And trust me, there are various other possibilities in silk. Right now, what we have done is just tip of the iceberg. Wound care is just tip of the iceberg. There are a lot of possibilities in the area of cosmetics, in area of other various other applications which are yet to be explored. Probably someday we will explore those things also once we reach a certain extent in Fibroheal. But I said the way it is. I said it the way it is, Gargi.
Yeah, it's very very inspiring. Actually, I was when you were speaking about these applications of your products and how you are giving a premium thing or more better product in a similar conventional price. So and the win-win situation that you have created, I mean, I must say win-win-win, I mean, maybe another win. So
Correct.
that circle is very nice. So like as you said that silk has a lot of possibilities in other sectors. So I was just curious to know that is there any other I mean, if you think that you can share about it. So is there any
Surely.
innovation, any specific project that you are working on, or you are very excited about it for the near
So
future?
I'm very excited about silk as a molecule itself. A lifetime work can be dedicated to it. There are various food applications. It's a protein which has negligible fat. You won't get a protein without fat. So it can be become one of the excellent diabetic foods. Cosmetic application, it has many. And out of many, I will see if I have something on the table. See, this is a product which is used for stretch marks.
Okay.
It's now if you see stretch marks was an application which came out just because of the sheer moisturizing property and ability to remove stretch marks. So when the woman is pregnant, after fourth month, there is a lot of itching and other things happens because of the, and that is what it is able to address. People are worried about those lines, and and you will be surprised to know that 100 gram is for 150 bucks. That's all.
Oh my god.
See, and it is able to handle stretch marks. This is what innovation can do. This is just an application which is an extension of R&D. Similarly, if you coat the food material, if the shelf life of a banana is, let's say, 4 days, if you coat it with some of the silk protein at a specific concentration, it can last up to 10 to 11 days. And silk
Oh,
protein is natural. Silk protein you can
yeah.
eat. There is no problem at all. So instead of trying to, so various places where cold infrastructure or ecosystem is challenged, this can be used. People are working on delivering vaccine technologies in African countries encapsulated in silk. Now imagine the kind of applications which are possibilities. But again, how much you can do, at which stage, how much you can do is what, as we are digging deep, we are realizing that I'm just at the, that's why I said we are at the tip of the iceberg. The possibilities are immense. These are simple some of the points what I mentioned. Similarly, there are
Mhm.
possibilities which are related to artificial insemination, where a high quality bull semen can be cryopreserved and then thawed again, and that's how the other, that is on the agri and rural side. So it silk has potential to become an economic multiplier from various perspectives. Wound care is just tip of the iceberg. I mean, many of the viewers who may get the idea, these are some of the points to pick, because you can only do so much in a life. Your time is also limited in this world. No one can do everything in
Right,
this world. So these are all
right.
the where people can explore, and particularly northeast area where Eri Muga is grown, Karnataka, Andhra, Tamil Nadu, part of Maharashtra or Kashmir, people can get, and this can, if you are able to help generate 10, 20 or 50 employment, you have done your bit to the to your country wherever you are born.
Absolutely.
That's how
Absolutely.
we see that those possibilities are there. There. So Gargi, these are the thoughts. What we have already. Many of the projects we are already for a fun thing we are exploring it. But I don't know, unless something worth happens. It's I may not be able to reveal it.
Absolutely, I understand that. But it's amazing the insights, the directions you said. I mean, with the applications of silk as such, I mean, this is very interesting. Some of the things I was aware, but not all the things that you said. I mean, that's fantastic. That's really nice. So, uh, we are almost at the concluding part of our conversation. I really don't want to let you go, but yeah, we have to draw a line. So, what would be your message to aspiring entrepreneurs, particularly in the biotech sector? Because, as you rightly said, when we are trying to do something in India, it's a long curve. So with so much of experience, and you have established things, and you are addressing the people's pain, so what would be your message to aspiring entrepreneurs in biotech sector?
So, so whether you are in biotech, medtech, life science, healthcare, in general, one thing I will highlight is the most important thing is you need to have the longevity to last. That is the most important thing. Trust me, nothing happens overnight. You always undermine what you can. You always, exaggerate what you can achieve in 1 year, and you always undermine what you can achieve in 5 to 10 years. Trust me, the compounding actually plays in every sphere of life. So if you are trying to build a startup, never say that 3 year I will do this much, this X revenue, this X valuation. Build a 10-year plan. Nothing works even in 5 years. Trust me. If you want to make something genuine worthwhile, so in that case, plan for 10 years. First 3 years will be learning, 3 to 6 years will be hustling, 6 to 10 years will be minting. That is when you will start seeing the fruit of the 6 years hard work. And that's where, so make a plan for 10 years. Third, stay focused. I know that it's a very lonely journey. You are considered that you know everything. You investors think that you have problem for you have solution for every problem. Investors think that how to give them exit. Your people think that you have bag full of money and you will be able to pay people and give 20-30% growth year on year to the people. Government officials feel that you are very rich, and that's why you afford to take care of everyone. And bankers feel that you come from very rich family, that you have all the property so that you can mortgage and then fund your company. Trust me, this is what it is. That's why they say that people who are able to hustle it out through this, they will be able to succeed. So one important aspect is stay positive, optimistic. There is you are going to be face a very lonely journey where the only thing which is going to support is your positive and optimistic thoughts. Second, be prepared to hustle. Make a 10-year plan. Never make a 3 year, 5 year plan. Build 10-year plan, cut it down into 2 years, and then break it further into quarters or whatever you do. But be prepared to give 10 years, and if you want to actually create that impact. Third important point is don't forget to enjoy. Don't show that I'm working. It should be fun. I will give you some example which probably you guys would have also noted, that when I was talking about Fibroheal, my energy went up drastically. This happens when you do something which you love or which you are passionate about. So only if you are passionate and you love it, you will be able to do justice to whatever idea concept you are making. And fourth point, don't run behind money. Money is a byproduct. It's exactly some famous saying. I'm forgetting the name of the author who mentioned that if you want to have butterflies in your home, plant a garden in your home. You can't catch the butterflies. Create the garden, butterflies will come. That same applies for money. If you are able to do things nicely and correctly, people will come to your home. In money will come, growth will come, impact will come, satisfaction will come. All those things are there. So with these 3-4 points, hustling, 10-year plan, focus, and most important message before I hang up is be transparent, be honest, be upfront with your people. Trust me, there is nothing like you build a company, you build an organization with people, not the idea. And alone you can't do. You need people to build it. So be very transparent, open. Trust me, tough decisions, looking into the eyes and sharing it is much effective than trying to do it via email and through someone else. So better
Right.
get transparent. Trust me, these are some of the points what I have learned and what have helped us to scale Fibroil to where it is.
Thank you, Vivek. It was wonderful talking to you, and thank you for all the insights you shared. And we are really so happy and proud that you are an Indian startup, and you are doing amazing work. And I wish you more luck, and I wish more growth to Fibroheal and all your other innovations that's in progress. Thank you so much.
Thank you, Gargi. Thank you, everyone. Thank you for having me on your platform, and thank you for those various thought-provoking questions which you put forward. Thank you
Thank
very
you.
much. Namaste.